Pneumocystis jirovecii pneumonia or PJP is a type of pneumonia caused by a fungus named Pneumocystis jirovecii. This fungus is common in the environment and it can infect people who have weakened immune system due to illness such as HIV, and it can cause lung infection. The purplish spots on KD skin, it indicates the existence of Kaposi sarcoma. People with weakened immune systems, such as patients with HIV, have higher potential to develop Kaposi sarcoma. Besides, Kaposi sarcoma can be a signal of the final stage of HIV infection.
Next, for the question number 3, so differentiate between the HIV positive and AIDS. So the key difference between the HIV positive and AIDS is that a person with HIV may experience HIV without developing AIDS, as the HIV is a virus that shows mostly no symptoms. But for AIDS, on the other hand, it is a disease that mostly shows similar symptoms to other diseases such as meningitis, tuberculosis, and even a cancer. So next, for the question 4, why is steady development of KS and PJP of particular importance in light of his HIV status? First and foremost, it is critical since developing KS, since it indicates that his HIV is progressing to AIDS. After years of living normally with HIV, the person's immune system weakens and they get AIDS. At this point, the person is prone to any variety of opportunistic diseases, and this can affect to any area of the body. Infection can range from fungal infection and colds to serious illnesses like tuberculosis and also cancer. Last but not least, for the question number 5, KD has been seropositive for several years, yet he has been asymptomatic for AIDS. What factor might have influenced KD development of PJP and KS? Is that when he stopped taking his medicine and he began to skip his meals, which has led his nutrient intake fall short. This has caused his body are exposed to become vulnerable to injury. He could also be labeled as malnourished, which increased his susceptibility to illness and also accelerate the progression of having AIDS.
Question 6. Identify 4 problems you must manage regarding KD. The first important thing to do is treating his pneumocystis jirovecii, as this disease can be life-threatening to people that have advanced HIV infection. Second is to monitor and control his fever so that it will not get worse. Third, manage KD's nutrition intake. Make sure he does not skip meals and get enough nutrients needed for the day. Fourth, manage KD's stress level and make sure he gets enough rest. He needs to sleep at least 7 hours a day. Question 7. What precautions will you need to use when caring for KD? Avoid placing KD that have pneumocystis jirovecii in the same room with immunocompromised patient, as there is scientific evidence that it can be transmitted via airborne route. Second, practice hand washing and always keep things clean, as it can get worse for susceptible patients in a dirty environment. Question 8. What is the focus of your ongoing assessment? The focus is to monitor his temperature and alert if there is a rise in it. Next is monitoring his oxygen level and respiratory status, as the main symptoms is shortness of breath.
The major side effects that KD should be monitored for including skin rash or Stevens-Johnson syndrome, difficulty in breathing or tightness in chest, sore throat, fever or cough, abdominal cramp or muscle pain, nausea, vomiting or diarrhea, hyperkalemia, unusual bleeding or bruising. These symptoms may indicate the presence of severe adverse reaction in KD, and it may lead to fatality. Next, what aspects of KD's care can you delegate to the LPN? These include 4 aspects, which are A. Administering first dose of intravenous trimethoprim sulfa-methoxazole Bactrim. B. Monitoring KD's pulse oximeter readings and reporting the values when they were under 95%. C. Developing a plan of care to improve KD's oxygenation status. And F. Repositioning KD's and having him deep breath for every 2 hours.
For questions 11, the patient asks why he has to keep taking the drug since the pneumonia is gone. How would you respond? I would respond by encouraging the patient to keep taking the prescribed drug because of his weak immune system due to HIV. Therefore, for me, KD needs to keep taking medicine because the pneumonia may not be fully treated as his immune system cannot fight the infection completely and the disease can reoccur. Furthermore, if later on he is exposed to the organism again, reinfection with the same or different microbe can occur, especially if they have underlying health conditions that make them more susceptible to the infection. Question 12 asks us to give at least 4 additional topics that should be discussed with KD before he goes home. The first additional topic is medication management, which are the side effects of his medication such as nausea, diarrhea and skin rash. The second one is also from medication management. He has to know the consequences of stopping antiretroviral treatment or any medications for the disease. For instance, stop taking medicine can worsen his condition, create more symptoms and may lead to death. The third one is what to look for if a new infection occurs. This can be told during a follow-up appointment. If the patient is getting a new infection, he is advised to visit the hospital or any healthcare facilities as soon as possible. Besides, he can contact the department regarding any question. The last additional topic is how to optimize the patient's immune system. The ways are same with the encouragement above. He can practice regular exercise at least 30 minutes per day. Besides, he needs to manage his stress by doing yoga or systemic breathing. And lastly, the consumption of healthy diet is crucial for people with weak immune system.
Question 13. What laboratory data will most likely be monitored in KD in the future? Firstly, complete blood count test that measures the number and proportion of red blood cells, white blood cells, and platelet in KD's blood. Secondly, CD4 T cell count, which is a test to check the amount of CD4 cells in the body. For HIV patients, amount of HIV attacks the CD4 cells influence the CD4 T cell count. If KD continue to the ART treatment, it may help in increasing the CD4 T cell count and show the steadiness of immune system. Thirdly, HIV viral load that measures the number of HIV particles in blood. The test assesses the progression of HIV in the body. CD4 T cell count and HIV viral load is important to follow up the progression of HIV in KD's body, how his body responds to HIV therapy, and how the virus itself responds to HIV therapy. When viral levels become undetectable, the virus is no longer transmittable. Question 14. List at least 5 other opportunistic infections that KD is at risk for developing. As KD's condition may lead to AIDS, he has badly damaged immune systems. He might get an increasing number of severe illnesses called opportunistic infections. For instance, tuberculosis, gastroenteritis, pneumonia, encephalopathy, and meningitis. Tuberculosis is a disease caused by a bacterium called Mycobacterium tuberculosis that are spread from person to person through the air and is one of the leading causes of death among people with HIV. Gastroenteritis is a condition that causes diarrhea and vomiting caused by a bacterial such as Salmonella, Enteriditis, and Campylobacter jejuni. Pneumonia is an infection caused by many germs, including bacteria, viruses, and fungi. And the most common and life-threatening is infection of bacteria, Streptococcus pneumoniae, also called pneumococcus. Encephalopathy, which is brain infection with HIV and result in inflammation. Meningitis is an inflammation of the protective brain membranes covering the brain and spinal cord and caused by cryptococcal meningitis that affects 30% of patients with HIV-associated meningitis.